Welcome to a course in breathing. Breathing, chest function, mobility, all have to do with one or the other. When your body has to negotiate breathing, balance, and heart function, it will choose those activities first. And usually when you're in a hyper response with those, when you're very concerned about your breathing or your mobility, it's not going to be learning from that day, it's going to be trying to survive. So that's a difference. So here's a great little course. You can be at your desk on a computer. It doesn't need to be anything fancy. So I'm just sitting a little bit below my table height in my chair, and I'm working with a little bit of a deflated ball. Now, again, movement lesson is about functional movement. You can try and see what it's like at first, where you're going to look to the right and you're looking to the left. Now notice, do I have a lot of chest activity? Do you feel it? Is it more a head activity? Is it hard for me to do those skills? Am I weight transferring over the elbows? Great, make those notes. Now, I don't expect necessarily a person to be working on crawling and rolling around. That's fine. We're here seated. You can be doing this at your kitchen table. So again, we're going to have a ball that's a little bit underinflated, and we're going to be working with the sternum. So now it's not about balancing the ball. What we're going to be doing, and I'll be doing this without the ball as well as with the ball, but I like feeling it first. So you're going to be feeling that you're pushing off to the side. You're pushing off to the side versus just rolling the ball around. When I'm reaching for a cup, let's say, any kind of upper body activity, this is a great way. If you're here, it's very difficult versus being able to come out. This will really help your diaphragm. This is going to help a lot of your skills. So let's get started. Hi, it's Michelle from Movement Lesson, and now we're starting with lesson 1. And again, you see my knees at the table. You can go a little bit below, however you want to go. I'm getting used to just working with the ball. Now at first it might feel like a simple rotation, but I'm just sort of feeling my weight transfer. Now we're going to get started. Slowly go to your right. And right now you're just going to take your vision in the center and move your vision slightly over to your right hand. Continue with that nice, gentle, easy movement. Just floating over to your right hand. Now notice if your head is moving more than you're moving the ball. Notice if the ball's not moving at all, but your head is moving. But also notice if your head and your eyes, your vision is going gently with the ball's movement. Come back to center, and now we're going to do the same thing to the left. Slowly move the ball over to the left. And now slowly just bring your eyes over to the left. You don't have to focus per se on each little finger. That will be more complex. Right now you're just again noticing, is it more of your head doing the movement, your chest, your eyes, or you have this nice little synchronized movement of looking over to the left with the ball and your eyes. Now leave that alone. Now notice at this point if you need a rest. If those of you need a rest, you want to sit up, that's fine, and you can pause the tape. By the way, I'm not going to keep reminding you to pause the tape if you need to. That'll be your choice, just letting you know that at any time you can hit stop and hit go. So now with that, we're going to go to the right with the eyes and look at the hands, and to the left. Notice my tempo. Look to the right and look to the left. You want to keep in general your speed, your tempo, your body's momentum in that kind of course, as if you were saying look to the right and look to the left. Now if you're a marathoner, I can say look to the right, look to the left, look to the right. If you're a runner, things. You want to keep, again, your tempo, your momentum into functional movement. Look to the right and look to the left. And now I want you to leave your eyes alone with all of that. And now with this, we're going to bring the attention back to the chest. And with the chest, I'm going to go back to now moving the ball, almost like I'm trying to hold it to give it to my hand and then come back again. So if I was trying to move the ball over to my right hand, and again, and again, and now I'm going over to the left. And notice, obviously, the ball is not going to my left hand, but that's my intentions. But I don't need to incorporate vision at this time. And now I want you to think about something a little bit different now. I want you to bring the sternum almost towards your left elbow, sternum, midline sternum. So again, I'm bringing this sternum to my left elbow. And now from here, I'm going to take that sternum and almost, like again, pushing it up, but I'm coming below the ball and moving up towards my hand. So my trajectory is left knee to right hand, or left elbow to right hand. And now I'm going to go over to the other side. If I need to adjust the ball at that moment, I will. Sternum is now towards the right elbow, and now pushing that ball over to my right hand, left hand, sorry. Right elbow, left hand, and right elbow, and left hand. This is a great move that will happen when you're in crawling. For crawling, you're able to do all those things, but also it's a great move, especially for those with ADD issues, because I can tell you right now, this movement, even though it's simple, is going to be a little bit challenging, and that's so fine. That's just fine. You're here to learn. And leave that alone. Now come up if you need for a second. And now we're going to come back. Now I'm going back to the first one, coming up, looking at the right hand, looking at the left hand. Just see if that got any different. Going back to my right hand, I want to come down a bit, and to my left hand, not just side to side. I'm looking to do an arch. You can see my head arching. This is really great for advanced vision techniques. But hopefully a lot of you are realizing how much you're using the chest bone for your movements, more so than just a head lift. A lot of people write me all the time saying, how do I get my child's head or the neck stronger? That doesn't happen that way. It happens this way. And we lose these skills, especially for those of you who have a kyphosis and so forth. So now some of you might be down this low, and this is as much as you're going to give it. Don't worry about the eye contact going forward. We'll be working on that. Again, come up to sitting. And then come back down again. Now what I'd like to do now is to work on your breathing. So let's go to the next video. Thanks, bye. Hi, it's Michelle Turner from Movement Lesson, and we're here at the next video for breathing. So we're in the same position we just was in. And with this now, what I'm looking to do is to go up on the elbows, but you will feel the ball. This is where I like to work with a deflated ball. So if you're not feeling that almost like a bounce, that squishiness, you want to like take a little air out of your ball, or maybe you're feeling where the elbows are off too far or too narrow. So the elbows really are coming underneath the shoulders, around that area. So now what I'm looking to do is, in a sense, bounce my ball, but obviously I'm not going to. It's staying between the table and my chest. So I'm pushing down on my sternum and now letting myself come back up with the ball bouncing. For those of you that do yoga, it's sort of like cat and cow pose, that you're going down and you're coming up, but you're only thinking of the breastbone of that combination. Don't worry about arching the back, anything like that. Now what you should start to feel though, let's say that right now I'm going to stabilize my head, look into the camera, but I'm still going down and I'm going back up. But I'm not over exaggerating the pose. I'm not going into a full arc, let's say, in either direction. And now leave that alone. Now I'm going to be moving the ball over to the right side of my chest. Now this is going to be an interesting movement because I don't expect you to go, again, this down and up, right? What I'd like you to do now is take the right chest and push the right side in and then back down again. This is where we lose the skill of power. Has it been hard to like open jars or open up a door, little things like that, right? This is a great isolated movement that you could work again with the chest rotation, crossing midline, and then also we'll be working and breathing into this lesson. Again, I'm looking for the chest to come down. So here I'll do this without the ball, right? So I'm looking for that right side of the chest to come back down. I'm not trying to go here. I'm not trying to go here. Now with that, I'm going to move it over to the left side. This is anything as easy as mopping the floor. Again, that pushing, pulling. For those of you with door handles, but most of all, that breathing. If you're finding yourself getting out of the car now where it's hard for you to go through the car to get out versus having to turn to get out of the car first, you have to make that 3-point turn to get to the outside versus scooting out of the car. This is getting out of a booth in a restaurant. All of those kind of skills. Again, very functional of working side to side, but it's getting into bed through the chest versus just sitting down and trying to roll over that way. And as you can see, my tempo is just nice and slow. Just concentrating on the left chest, going in. Leave that alone and come back to center. And now feel the mobility that you're starting to get from the chest. Now with the ball and center, go right side. The ball is going to help you really again to feel that movement, that rotation, versus just necessarily pushing down on the right side. Leave that alone. Go now from left chest down. One of the reasons a baby's meant to put into tummy time from birth, not at 4.5 months, is for this reason. We'll be breathing from the back as well as through the chest. When we get used to sleeping on our backs, we really only think of breathing as through the chest. And it is important that your chest expands to the front, but it's also important if it expands to the sides and to the back. And this is why we're doing these lessons. And leave that alone. So now I want you to come back. Now I want you to start thinking of, instead of just pushing the ball down and up, I want you to breathe the ball down and up. So I want you to breathe first with your belly. So we're going to inhale the belly, right? And the more you inhale it, see again, not only does the ball get pushed down, but what you should start to notice is like the pubic bone strike. When you're breathing in through the belly, it'll bring the head up. That's where you're starting to synchronize all those great spinal movements, chest movements, organ movements into functional movement. You're going to be breathing nice and low into the belly. Breathe in. Breathe out. Notice too, if you're breathing in, that your head wants to go down maybe versus going up. Don't make changes right now. Right now we're just learning how to breathe and move. What a surprise. You should be able to breathe and move a lot. This is where my breathing lessons are going to be a little bit different, because we will be putting in functional movement into the breathing. We're not just isolating the breathing. That's where you see a lot of people where they have to stop what they're doing. Okay, let me catch my breath. Okay, breath in, because that's all I need to know how to do is isolated breathing. And that's not too functional. And leave that alone. If you need to catch your breath, come up, pause it. So now what I'm going to do, which is a little bit harder for me to talk, somebody talking you through it, but I want you to try not to talk as much when you're first working out the breathing. But I want you to breathe through that upper chest, that would over-exaggerate a little bit. So when I breathe in, see, my chest will come out again. See where my head is at, almost like Sphinx pose in a sense, for those of you that yoga. And then come back and you'll see more of the chest round. Now again, I'm doing this chest in, chest out. Don't worry about the rest of the body right now, other than being comfortable. In a sense, we'll be doing the same type of movement through different aspects that you can think of, even weight transfer over the feet, and then we can put it all together where your whole body is getting a movement lesson. And that's what I love about movement lesson, is your whole body is getting a lesson. Again, chest out, feel that head rise. Exhale, feel that chest come down, because what the ball is doing is allowing those movements to enhance going through your body. You can do this lesson without the ball. That is just fine. And we will be doing it as well. I'm using the ball more as a set of hands than I am the fact that we're rolling around on the ball per se. That was great. I'll see you at the next lesson. Bye. Hi, thanks for coming back to the next lesson. In this lesson, we're going to be continuing with the ball like we were just doing in breathing. But of course, now I'm going to bring it over to the right. So now again, it's just to the right of my sternum. It's the larger the ball that you have, and you can work with various sizes. Matter of fact, the more different variations you can play with, the better that you're going to be breathing in different situations. This is a great lesson if you're from a mountain climber really to post-operative care, that you need to just open up your chest cavity again or work with it. Post-surgery movement lesson is great. It's very gentle. But honestly, if you're post-surgery and you're just doing the lesson, let's say like this, and I'll go over just some quickies how to do it, on how to do it for, again, very low mobility to high mobility. So now with that, we'll start. You're going to go and do the same thing. Now I'm going to deep breathe through my belly. Now you're not going to maybe feel as much movement, but again, this is for the right. I'm not looking for you deep breathing. I'm just looking for you to breathe through the belly, feel yourself rising, coming up, and then coming back. I'm not looking for the right movement to coming in through the right. That would be another lesson. Again, that breath expansion, feel that belly coming, filling up, and letting the air out. Belly filling up, all through that right. This is why babies need hours of tummy time. You're working out so many things. Less tummy time you get, that's why you have higher anxiety, things like that, because you're not working on complex ways of breathing, stabilizing your vision, and moving. More variations we have to movement. Again, lesson in movement, movement lesson. Leave that alone. Take a couple of cycles with your breath. Take a couple of cycles with your breath. And now we're going to think of expanding that chest and then letting the air out. Guess what? For the munchkins, this is writing on my paper. Now I'm looking at the teacher, coming back. So you will have a passive and active visual convergence. But again, we're not doing a lesson right now in the vision. This is just getting used to working with movement lesson, working through gravity. And in this case, we're using the ball. And with that, I want you to move over to your other side, to the left side. Anytime you want to take more time, by all means. And you might feel a difference now. I feel a huge difference now, the ball on the left side versus the right. You know, this side is more supple at the moment. So again, now we're going to be breathing in through the belly. Nice full belly. I have a nice tempo. Feel that belly. And exhale. Feel the belly. And exhale. Feel the belly. And exhale. Ah, now my diaphragm is a happy camper. Diaphragm is in the low area, underneath the rib cage, right above your belly. And I just have a bit more room to expand my belly. And now leave that alone. And again, now we're going to be filling the chest and exhaling. So fill the chest. Now in general, I should not hear you breathing. We are not mouth breathers in general as well. We'll be doing both, but really, this is not about you call me up and ask for an appointment and I hear your breath. I assume you're chronic. You've got pretty decent pain and you're at that level. Same thing with the babies, children. Shouldn't hear breathing. Grunting, if you have to feel to open a jar, you know, those kind of things, you're holding your breath. It's not about counting. Again, I like the ball because it's supportive and it gives you more of that synchronized movement. And leave that alone. And I'll see you at the next video. Thanks. Hi, it's Michelle from Movement Lesson, and we're going to continue the next video. Hi, it's Michelle from Movement Lesson. We're going to continue with the next video. We're still working with the principles of core movement. That's what we're starting with the breathing and that whole chest movement. Some of you right now should feel a nice little supple chest versus feeling that movement has to go to the extremities. But we're still concentrating on the chest, but now I'm using again that ball out. Now if you just want to sort of give it a test run, I'm not looking to hold the ball. I'm not looking to use superior muscles, gross or fine muscles, if just active and passive. The work that I'm doing is still more on the sternum. So I just want you to feel now going out to the right and coming back. If you need to adjust the ball, adjust the ball. So now what I want to do is again pretend like I'm throwing or hitting the ball with my sternum. I'm rotating that chest out and I'm coming back in. Hi, it's Michelle from Movement Lesson, and thanks for coming to the next lesson. We're still working with breathing, that crossing midline, that rotational through the chest. You should start to feel that you actually have a nice little chest going. Again, this is something you can be done in a chair in front of your computer. Now I've got my elbows on my knees, but if you put your elbows on the table, I want a nice little passive movement, again not low tone but just passive, that you're working on these kind of core movement skills without going into gross muscle function. This is a very good lesson for what I call active passive stays of your muscles and your breathing and your vision, but at the same time I don't want one to consume the other. Good movement, you want to have that equal opportunity for that counter versus something being much more dominant than the other. Obviously, my right hand right now is being more dominant than the left, but at the same time, that weight transfer is what's getting me there. Do a test run. We're just going to be going out with the arm. And just feel, right now, I'm leaning on my left. And with that, I'm just not leaning on the ball, and I'm not grabbing active muscles again. I'm just looking for that weight transfer. Some of you might consider this a stretch, but I don't want to use those words because I don't want you to think it's just the arm. What we're doing here now is again that sternum. If you're not familiar, you might want to go back to those other lessons to feel it, but we're bringing that sternum as if the sternum was pushing the ball, or that ball in a sense had a string to my chest. And I just want you to feel going out to the right with that. From reaching to the salt, really having a much better conversation of your eye-hand coordination, but I'm not necessarily looking to see what color my nails are. I'm just really appreciating the movement. I'm not looking at you at the moment through the camera. If you need a shorter distance, if this is new for you, shorter distance, post-operative care, then again, this is fine. But just think more of the chest doing it than the hand. This isn't about force. Remember, force is force, movement is movement. So now, what I would like you to do is think about rotation of the hand. You're still bringing in that sternum, but I want you to think when it's close, thumb over pinky, and when it's far, pinky over thumb. So you're lightly just saying to yourself, what time is it? But again, go back to that sternum. You're crossing midline. You're, in a sense, you're pushing your hand away. When you start torquing that elbow, crossing midline on the elbow, wrist, what you're really doing is really bringing in that weight transfer. These are for skills of like closing the car door, turning on the ignition. You might laugh, but let me tell you, a lot of people get old quickly because of those little things that suddenly become difficult. Don't go too far. I'm not looking to stretch out the pelvic groin. Adjust your hand when you have to as you get a little overzealous and you start moving around. That's fine. Now we're going to do this to the left. You're putting your right elbow down and you're going off to the left. Do a test run. Now again, notice I'm not rotating the wrist just yet. Sternum. Now pushing the ball to the left. And I already feel that this movement is different for me. Maybe that push of the sternum is clear, unclear. Notice my tempo. Again, like I'm saying, look to the right and look to the left. Except this is just looking to the left. And to the left. And now start adding in that thumb. So thumb up and pinky down when the ball's close. And as we go far away, the pinky is up, thumb down. And now you really should feel that chest opening up. Functional rotation, you know me. I find it everywhere. This is getting out of bed. This is reaching for that alarm clock. Taking care of your babies. I'll leave that alone. Thank you, and I'll see you in the next video. Hi, this is Michelle from Movement Lesson, and we're going to continue this series of working with breathing and the chest functions. So in the last video, we were going out to the right and then to the left. We're going to continue that conversation. Now we're going to bring in more breathing. Breathing and the sternum. Sort of like patting your head and rubbing your belly. We're just going to be breaking it down, but at the same time adding to the complexities. So now if you're up to switching over the thumb to the pinky, that's fine, but if you want to just go to reaching out. So now what I'm going to be doing is, as I do this, I'm going to breathe in through that belly and come back. And you want to slow this to your breathing rate. I don't want you sitting here doing this. That's not the point. So breathe that belly in and come back out. Inhale through that lower belly and come back out. Really feel that chest twisting as you're bringing out that belly. Hinge it off to the left, over the elbow on your right side to your knee. Breathe in, big belly, come back. Don't forget about that sternum, crossing midline, that nice big belly. Really moving that chest. Come back, right hand and left hand. Bring it back to center. Now, let's just break this down. When I do that, see where I am to the left? Look at my counter. My right hand is out. I'm over on my left knee, elbow. Right knee, left hand out. Right? You will lose the ball if you're doing same. It is much harder. Again, I'm just that nice countering, because what is it doing? My breathing, torquing the chest, all of those kind of things. Again, this is when a child is starting to learn how to crawl. I don't want you to crawl, that's okay. Those of you that think that crawling is just 4 points, yeah, guess what? This is what crawling is to a baby and a child. That's why when I see crawling and they're doing more here, or they're on tummy time, let's say, right? And I hear things like, my child did a 180. Do you see that? Everything, I'm not crossing midline. That's why you're doing the 180. Now slow that down, and again now, belly out, to the right, exhale to the left. Big belly, exhale. Breathe in, breathe out. Breathe in, and breathe out. Functional movement and breathing. This is why it gets hard to do the laundry. People think it's all flexibility. But if you lose these synchronized skills, especially if you've had maybe a pneumonia or a surgery, things like that, that's when the body starts to say, wait a minute, this is getting a lot harder than I thought. Big belly. Breathe out. Big belly. This is really great for after pregnancy, getting that uterus back into shape. And leave that alone, and I'll see you in the next video. Thanks. Bye. Hi, it's Michelle Turner from Movement Lesson. We're going to continue this series just like we were doing. So in the last we were doing belly out, belly in. Now we're going to go to the chest cavity. Oh, let's do that backwards. So now we're going to continue with this lesson, and this time we were going to the right, belly out, and belly exhaling. So now we're going to switch it up, come to center, and breathe in, going to the left. So belly in, going to the left. Sorry. So belly out, going to the left. And exhale, going to the right, belly in. Big breath. And exhale. Again, look at my counter, how I'm countering, keeping it all, working on my body ratios, my breathing ratios. Now, leave the breathing alone. Just feel coming back, going off to the right. Pinky up, thumb down, thumb up, pinky up. Feel that chest rotation. Really love your comments when you start to feel again what it's like to get up out of the chair again. If you notice there's any difference, notice. If you notice any difference, to the left. You should really notice a big difference in driving. This going around, going around. Again, we've been doing it in a nice, safe atmosphere. You should also feel that your breathing is much more efficient. Doing left and rights, and left and rights. By all means, belly out, belly in. When you're feeling this, you want to go longer with the lesson, by all means. I think these are great little lessons that you're really going to get a much more efficient eye-hand coordination, better breathing, and by all means, add in your own pace. If there's a lesson you'd like to do more, take it a little bit longer. At the end of these, I'm breaking this down. I'll do one full lesson for it to be combined so you can see where that's going to go. I'm not going to talk through it, just to give you a nice little pace. Thanks. See you at the next video. Hi, it's Michelle Turner, and thank you for continuing the series in breathing and everything. Vision, eye hand, all of that. Chest torque, rotation. So now, well, the last video we did belly out. Now we're going to do chest down, breathing out, right? So when we're going to go off again, do that test run to feel it, although right now you should start to feel a much nicer coordination with it all. Again, if your ball is getting away from you, just deflate it a little bit more. That's going to when you have a really inflated ball, you just touch it, like bounce all over the place. I'm not looking for that. I'm looking for, again, that nice, almost like you're kneading it. This is not completely deflated. And if you want more awareness in the arm, then you're going to deflate more to bring that out and work on that. Again, not grabbing the ball. So with that, you're going to go again. Now, where I'm going to do this now, same things, torque the chest, all of that, but now you're going to breathe in through the chest. So breathe in to the right and exhale to the left. Breathe in to the right and exhale to the left. Really feel again how those movements are coming into play. You might notice, I think I'm doing a little bit myself, a little bit quicker just because of the coordination. Chest out and chest in. Inhaling, exhaling. For those of you working with weights, I would say cables. These are really great lessons to do working on weights if you're doing high-end skills, especially if you're training, crossfitting, those kind of things. Now leave that alone, come back to center. You should really just feeling a nice chest. Now same thing now, we're going to be starting off to the left, exhale, we're going to be doing the same thing starting off to the left. We're going to be inhaling, big chest, and then exhaling. In, out. So we're going to inhale and exhale. And inhale and exhale. This isn't about doing something right. It's learning how to have functional movement, how to coordinate all your movements around each other. Inhale and exhale. But there's no right way to breathe. Breathe with functional movement. The better you function, the better your systems just work together. We're just breaking this down on breathing. Again, I could be doing this whole lesson right now, which is my plans to do it, but just with the attention, let's say, of counterbalance to the feet, ankles. You can concentrate this whole thing on just hands. Thank you. I'll see you in the next video, or we'll start putting this all together. Thanks. Bye.